By the year 2030, 20% of the population will be 65 or older, about 70 million Americans. And the medical community is sounding the alarm. The number of geriatricians in the country is sinking. As WECT's Bob Townsend tells us more about that in Your Family Matters.
As more baby boomers become seniors, there are fewer doctors who specialize in senior health care. Just 10 years ago, there were about 9,000 geriatricians. Today, that number is down to just 6,700. Why the drop in doctors that are trained to treat our older population?
At this point, at least here in America, I think we're falling short in addressing that problem. So it is certainly approaching crisis concerns now and will be that much more important to deal with here in the next few years.
Pull straight back. Straight. There you go. Just like that.
Lifestyles may be another reason for the decrease. Many medical students are pursuing specialties with 9 to 5 hours and fewer emergency calls. But there is some help coming to the area. An alliance was reached this summer between Coastal AHEC at New Hanover Regional Medical Center and Davis Healthcare Center to address the critical shortage of geriatricians in southeastern North Carolina. Under the new agreement, physician services for residents on the Davis Healthcare campus had been provided by private doctors in the community. Now a full-time faculty physician from Coastal AHEC will be on the site at the Davis campus to supervise doctors in training.
It also exposes them to this type of care in this type of community and gives them the impression that nursing homes and adult care communities are just that. They're communities with broad spectrums of needs and contain quite functional patients who are just living their lives.
It was a good opportunity with us being the only nonprofit facility to give back to the community by providing a place to train these geriatricians.
Because of the growing number of senior citizens, the hope is that some of these resident physicians will enjoy it enough to consider it for their specialty, whether they stay in the area or move to other parts of the country. It's one way medical schools are trying to alert physicians to the shortage. A recent poll indicated that out of 100 medical students surveyed, only one indicated they had planned to specialize in geriatrics. Some have predicted a crisis in senior health care, and many medical schools are pushing the government to offer students financial incentives to pursue geriatrics. They're hoping lawmakers grow wiser to what some predicting will be a crisis in senior health care as the U.S. population grows older and we baby boomers enter our golden years. For Your Family Matters, I'm Bob Townsend.